Hi, welcome to our YouTube channel. My name is Beth.
I'm Rich.
And today we have our new series, Pharm Facts in 5. This will be a fun series where you'll be able to learn about diseases and treatments in just under 5 minutes.
Today we're talking about cold sores and canker sores. Actually, Beth, I have a very interesting story to tell you. About a year ago, a patient came in. She mentioned to me she had a sore in her mouth. And what she did was she quickly grabbed my hand and stuck it in her mouth. And I was in shock. Like, my finger was actually in her mouth. Beth, it kind of looked like this.
What are you doing?
Just a reenactment. But getting back, today we're talking about cold sores and canker sores.
So, cold sores, also known as sun blisters or fever blisters, is caused by herpes simplex virus 1. They are also known as herpes labialis, which is different from genital herpes, which is caused by herpes simplex virus 2. People can normally tell that they're going to get a cold sore based on the tingling and itchiness of an area of the face where the cold sore may present. Cold sores generally look like red, fluid-filled blisters that appear in groups or as clusters. When the blisters erupt, you may see crusting over the sore, as well as it could cause scabs. These typically take 2 to 4 weeks to heal completely. Cold sores present generally around the mouth. So in really rare cases, you'll see them on the lip, around the nose, or on the face. Active transmission is typically through open sores and skin-to-skin contact. But you can also contract cold sores by sharing utensils, sharing drinks, kissing, or using the same chopsticks. Researchers say that 90% of the population are carriers. This means that majority of the people may never experience signs and symptoms. When they get infected, the virus lays dormant in their cells, and the cold sore may emerge eventually due to triggers. Some causes, otherwise known as triggers, include stress, lowered immune system, overexposure to sun or wind, hormonal changes, trauma to the face, or fever. Treatment options include over-the-counter gels and creams which contain lidocaine and benzocaine, which can help with the relief of symptoms, as well as Abreva or docacenol, which can help shorten the duration of how long a cold sore is present. Prescription options include acyclovir, valacyclovir, and famciclovir.
Canker sores, also known as Aphthous ulcers, are found inside the mouth, unlike cold sores, which are found on the lips or on the face sometimes. What a canker sore looks like is that they're usually round or oval in shape, and the center is usually white to yellowish in color, and you'll notice that there's like a little thin red halo around the sore itself. The exact cause of canker sores is still unknown, but scientists believe that there are 10 things that may trigger these canker sores, and I'm going to list them, with number 1 being stress. As you know, when your body is undergoing stress, you're more prone to getting certain diseases or getting sick, and you're also more prone to getting canker sores. Number 2 is genetics. I get canker sores once in a while, and I have a daughter, and when she was about 4 years old, she started to get canker sores because she ate too many French fries. Which leads us to number 3, foods. Foods like nuts, spicy foods, fried foods may increase the chance of getting canker sores. Number 5, injuries to the mouth. For example, if you bite your tongue, you bite your lip, or even get hit in the face, then those lesions may turn into canker sores. Number 6, a poor immune system. So if you're a person who gets sick often, then unfortunately you may get canker sores more often. Number 7, nutritional deficiencies. Being deficient in B12, iron, zinc, folic acid may cause you to have a higher rate of canker sores. Number 8, medications. The drug class NSAIDs, which include Advil, Aleve, and aspirin, antibiotics like amoxicillin, blood pressure medications like ACE inhibitors, and also methotrexate may initiate canker sores. Number 9, a poor dental hygiene. It's so important to brush your teeth and to keep your mouth clean. If not, you may see some canker sores. Which leads us to number 10. It's actually an ingredient found inside toothpaste and mouthwash. Dentists say surfactants such as sodium lauryl sulfate and sodium dodecyl sulfate may increase the likelihood of getting canker sores. If you ever had a canker sore before, you know how painful and irritating they can be. So there are some things you can do to reduce the duration and decrease the pain. For example, you can avoid eating certain foods like chocolate, spicy foods, fried foods, and even acidic fruits and vegetables like lemons, oranges, and tomatoes. All of these foods will cause inflammation to the area, therefore prolong healing time. If you're at home and you don't have anything, you can just use a tablespoon of salt and mix it with a cup of warm water and rinse 3 times a day. Or you can go to the pharmacy and purchase Amlostan, which is a topical antiseptic rinse. And this would, same thing, you would rinse 3 times a day and therefore increase healing time. If you're experiencing a lot of pain in your mouth, there's products like Ambisol, which is this one, or also Oragel, which contain benzocaine. And benzocaine is a topical anesthetic which will numb the area, and you would apply it to the affected area 3 times a day. You can also purchase topical steroids, things that contain fluocinolone, and this product here is actually a prescription item. This is called Oracort. This contains triamcinolone, and with topical steroids, it actually reduces inflammation of the canker, which also reduces pain. If you want to experience a lot of pain and maybe quicker healing time, you can go to the doctor and also get it cauterized with something like silver nitrate. It really burns like crazy, but it'll heal faster.
Thank you for watching our video. We hope it was informative. Please like and subscribe so you can tune in next time. What are we doing next time?
We're going to be doing something that everyone experiences, and that is constipation. Have you experienced constipation?
Yes.
Yes, so through the next week, Beth and I will be trying different medications for constipation. But we have here is the fleet enema, and if you don't know anything about the fleet enema, this is something that doesn't go in your mouth. It goes the other way. So Beth, let's decide who gets to use this. We're going to do only one round of rock, paper, scissors. The loser has to use this. Ready?
Rock,
1, 2.
paper, scissors.
Ah!
No!
I won! I won!